Dr. Samir Parikh and thoracic surgeon Dr. Mohan Kulkarni. Welcome to the show.
Hello, Bart.
Thank you.
Nice to see you. Welcome back, Dr. Kulkarni.
Thank you.
And Dr. Parikh, it's your first visit. Welcome to JTV.
Thank you very much. Glad to be here.
How long have you been with Henry Ford?
About 22, 23 years now.
Great. All here in Jackson?
All in Jackson.
Radiologist. So you're looking at scans, x-rays, and tell us a little bit about what you do.
So our daily job is, of course, looking at the CT scans, plain x-rays, MRIs, ultrasound, nuclear medicine, all those things, which come under imaging services.
Has the equipment changed dramatically since you started?
There is exponential growth of this technology that goes on. We just installed about a year ago, almost a year ago now, a new MRI. It's a state-of-the-art new MRI that we just installed, which can do many more things than we used to do.
Yeah, and I know when I've had scans or x-rays, the tech, has that on the screen, and I have no idea what it is. And, I know the tech does, but they're not as advanced, obviously, as the radiologist. Does it become easier with the advances in the technology to read scans?
Yeah, there is definitely a learning curve, especially with the new AI stuff that's coming in. So you probably have to be very familiar with that, and that really helps us, in terms of our productivity, our efficiency. So yeah, with the new technology coming in, we learn about it and we become more efficient.
Is it ever going to put you out of business?
I don't think so.
And
on the contrary, they will need us more.
Yeah, well, I would imagine they become more detailed, but with that detail, it becomes more necessary for someone trained as a doctor to see what's on that screen.
Yes.
We were talking at lunch about surgery, and we've had a chance to visit your OR and see some of your robotics surgery equipment. Thoracic surgery is the specialty. How do you define that, Dr. Kulkarni?
Sort of everything between the neck and the belly. Everything that's covered by the rib cage is thoracic surgery. And I do remember you visiting the robotic room, and we had a chance to sit some of the visitors on the robot and get a chance to see how it all works inside the patient's body. Again, technology has made our jobs easier. It's also been better for patients as well.
Everything essentially in your torso, in your trunk, then?
In your chest, yes.
Yeah.
Yeah.
All right, today we want to talk about screening and lung cancer. Lung cancer, you'd imagine that people that smoke would be most at risk, but is it just smokers?
No, it is not just smokers, but majority of the lung cancers, that we see are from smokers. So smokers, I would say about there is 80% of total cancer that we see are smokers. They are smokers. Mm-hmm. But there are a lot of other factors, that also can cause cancer too.
Smokers. Let's talk about obviously cigarette smokers, but what about vapors and marijuana smokers? Are those risky behaviors for lung health?
Anything that contains nicotine is very harmful. But also remember that all these, vaping and marijuana, they also mix a lot of other chemicals. So those chemicals are also not good. And as much as you deeply inhale, it stays in the longer period of time in the lungs. That has more time to damage the lung.
Risk factors, smoking, what else?
So as we know, we live in a cosmic pool, radiation pool here. We can't avoid that, especially the earth gives out radon. So that radon is one factor. Mm-hmm. That's very, very important, to remember. Asbestos, people used to work in asbestos factories or asbestos, plants. They are exposed to that, so they are also at a high risk of cancer. Mm-hmm. And then there are also radiation, like people who are radiation who deal with uranium, they also get it. People who have had a radiation therapy, like for different reasons, like they can
Really?
get, they can
Radiation
get.
therapy?
So radiation therapy, in a sense, if it is really a longer period of time, they put them in a higher risk. Not that they are going to get it, but they put them at a higher risk. There are a lot of chemicals that can cause, like arsenic or beryllium or chromium. All those things can cause cancer.
We're not seeing like some is geographical. We don't have any miners, coal miners in this area, but there's another area where in parts of the country.
Yeah, so the coal particles, they are also, like, tar, asphalt, tar, all those things can, and air pollution, even diesel, I would say, exhaust, for a longer period of time, if the exposure is long enough, can cause cancer.
All right, lung cancer screening. I remember we talked about this a few years ago, where the technology was not widespread availability, and it was expensive. So you only wanted to screen the most at risk.
Correct.
Is that still the case?
Correct, yes.
Okay.
So, in order to start, lung cancer screening, CT, first of all, we do a low dose screening CT. So CT is a must part of this exam, because that's how we detect cancer. And so we select an age population where a population that falls into this USPSTS criteria, United States Preventive Service Task Force. They have defined the guidelines of who should be screened. The person must be asymptomatic, between 50 and 80 years of age, at least 20 pack year history. So those are the three criteria. At the same time, this asymptomatic individual, with the I would say consultation with their primary care provider, must be able to or willing to undergo treatment. So if you find a cancer or a suspicious nodule or mass, you must be willing to undergo a treatment, or otherwise what's the use of doing a screening test if you are not really going to follow.
So there's a point where a doctor can discover, your cancer, your lungs are filled with cancer. There's nothing we can do.
That's possible.
That's possible, and that's where you come in. There are things you can do. What are treatment options if cancer is found in the lungs?
So if we have a patient who's willing to undergo treatment, like Dr. Parikh says, and then patient has decent lung function, they're able to, walk to the mailbox and back, they're able to take their dog for a walk, they can climb 2 or 3 flights of stairs, those are good candidates for surgery. And if you find, like our hope is with screening, we find earlier stage lung cancers, smaller cancers that haven't had a chance to spread, those are great candidates. So that's why we recommend the screening, so we can find them early. If we can find them early, we have a chance to cure them. And that's very exciting for us as doctors. And we can do robotic surgery on them if they're small, and then we can make smaller holes. We used to make large incisions on the chest. Now we can make tiny little holes on the chest and put a camera in and use robotics to remove that part of the lung that has the cancer in it. And if they're small, if there's no evidence of spread to lymph nodes, we're looking at a potential cure.
Really?
Yes.
And you guys remember in the 60s, 70s, you had lung cancer diagnosis. That was the death sentence.
That was. So now the earlier ones we hope to cure. But even if you come up with late stage cancers, now stage 3 or 4, for instance, we have amazing treatments now. They're targeted therapies, they're immunotherapies, they're chemotherapies. We work as a team for lung cancer. We have cancer doctors, we have the ones that give chemotherapy, we have radiation doctors, we have surgeons, and we have radiologists. We get together every week and evaluate new cancer diagnoses that have happened in Jackson, and then we formulate a plan that's very specific to patients based on their health, their age, and other factors that may go into treatment, as well as the stage of the cancer.
So how do you know you should get the screen? You've got the risk, you fit into the age range. Do you have to ask your doctor to get the screening?
Yes, so we do ask, a primary care provider or a person's and a physician to send us an order, because once we find an abnormality, we must communicate to his or her doctor, so that they will then create a plan of treatment.
I think that's really nice to know. There's a team that you don't. It's not cookie cutter. It's not assembly line. Everyone's different, and you take a team approach to a patient.
We call it precision medicine. I usually tell patients cancer is a team sport now. We're not individual. We come together as a team, about 15 doctors here in Jackson, all focused on his or her care.
All right, and one more question to lower our risk so we don't even have to worry about that. Stop smoking. What else?
I think that's the most important factor, but I think that also overall your own personal health, the exercise, nutrition, good sleep, all those things are very important, because that really boosts up your immunity, that really can fight, those bad cells. So there is no other vaccine available, to prevent a cancer of lung.
Well,
Check your basement for radon, and avoid secondhand smoke as well.
Oh yeah, radon. Yeah, get radon tested. Well, we appreciate what you folks do in our community, and thanks for taking the time to be with us today.
Thank you.
Yeah.
From Henry Ford, Dr. Samir Parikh and Dr. Mohan Kulkarni.